So today, I'm Angela Drent. I'm a health promotion specialist at Siouxland District Health Department. We provide public health services for residents of Woodbury County, and we're located over in Sioux City, kind of on the western part of Iowa. So just a little background on me and kind of the reasons why I was asked to present on today's topic. Really in the summer of 2014, we really just started a small focus group, which has kind of been built more into our All Abilities Health and Wellness Coalition. Um, that's what it is today. So our coalition started because of the small grant, which was really designed to improve health and medical access for people with disabilities. And it was that little grant that kind of laid the groundwork for our selection into a about 3.5 year project with the NACDD, the National Association of Chronic Disease Directors. And I would say it's really been this particular grant and that project that has really helped our coalition evolve and kind of really impacted our coalition's sustainability. So today I would like to start our session with a poll to see where you all are at with an inclusive coalition development. So we should be seeing here shortly the poll. So if you can just go ahead and answer that question, do you currently have an inclusive coalition in place, either yes, no, or working on it? I'll give you just a couple of seconds to finish that, and then we'll end the polling and see the results. Okay, so here are the results that you can see. Currently, there's one entity that does have an inclusive coalition in place and 2 that do not. So my hope today is that you will be able to pull some information out of today's presentation and really be able to implement it into some of the work that you're currently doing. And I know we do have individuals from a variety of different locations who do a variety of different responsibilities. So hopefully this information will be beneficial. And like I said, you'll be able to take some of it and utilize it within your group. So really, I'd just like to start with what is an inclusive coalition? An inclusive coalition is a diverse group of community leaders, organizations, and citizens who are really focused on disability inclusion. And it's that disability inclusion in programs and services related to physical activity, nutrition, and obesity. So really, what is the purpose then? So we know what an inclusive coalition is, but what's the purpose of it? So it's really to look at removing barriers that prevent people with disabilities from achieving the same health transformation opportunities available to community members without disabilities. And it's doing that through the creation and modification of community health programs, and then, of course, policy systems and environmental changes. So these things might be looking at making adaptive equipment available at an exercise class, making sure that we have curb cuts and truncated domes at locations that people need them so that they can access buildings and get around in their community safely and easily. It might be looking at lower access points for check-in or entry at medical appointments, or it might be a policy that allows caregivers to come into a health club for free with their individual that they provide support to. And it might even be just something simple like providing printed materials for programs and services electronically and maybe in large print format. And so why? The question is, why do we want to do that? Well, it's really, we really want to focus on creating inclusive coalitions for people with disabilities because a significant portion of our population are people with disabilities. Nearly 1 in 5 Americans has a disability of some kind. And this really comes down to a health equity impact. And we really want everybody to have the same ability. Everybody has the right to the same physical activity and nutrition opportunities as people without disabilities. And this is no different in Iowa. Approximately 21% of Iowa adults have a disability, and those disabilities can vary by type. Mobility disabilities, which are highlighted on the slide here, and cognitive disability in Iowa are some of our most primary types of disabilities, and those are just over 9% of Iowa adults. And there's other breakdowns. Visual disabilities are just under 3%, self-care disabilities around 2%, an independent living type of disability might be 4.8%. And you might have individuals with disabilities that fit into multiple categories as well. We also know that disability impacts health. And so adults with disabilities are 3 times more likely to have chronic health conditions like heart disease, stroke, diabetes, and cancer compared to adults without disabilities. And this is likely because people with disabilities are more likely to be inactive, more likely to be obese, more likely to smoke, and also have high blood pressure. So how do we change this? What do we need to do to be able to shift that pendulum and decrease the risk for people with disabilities? And one way that we can approach that is by building and implementing an inclusive health coalition. Here's a diagram that kind of shows the CDC's Inclusive Health Communities model. Commitment is really the first phase of this model. And I'm not sure if you guys have seen this before, but it is available on the CDC website with more information and more details of each phase. There's a link provided on the bottom of the slide for you if you would like to look into that. But this first phase, that commitment phase, really is where you're going to build that inclusive community coalition, or it might be looking at enhancing an existing one. But you will work towards making healthy living easier for people with disabilities and doing that where they live, learn, work, play, pray, or receive care. And you'll also want to encourage broader community engagement and working on developing partnerships in your community. This commitment phase really is extremely important because it is essential to building support and ensuring sustainability for your coalition. When building an inclusive coalition, you don't need to start from scratch. If you already have a community wellness coalition in place, you may want to just look at expanding your current coalition by adding a few individuals and bringing them together and working together to achieve some of your common goals. Or you may want to look at forming a small subcommittee to your current community wellness coalition. Or you could look at developing a whole coalition as well. So once you know how it's going to be best really to fit this inclusive coalition into your community, into your planning process, then you can start thinking about who you might need to bring to the table. You really want to have, and this is just standard kind of coalition development information, but you're really just going to want to have like maybe 10 to 15 people and have those individuals really represent all groups in your community, including individuals with disabilities. Oftentimes we forget to include the individuals that we are trying to improve the health of. And so we really want to make sure that we have those individuals with disabilities at the table. They really can bring a unique kind of perspective. They can help you understand barriers, and it'll help you kind of move things forward and create some buy-in for your coalition. There are also several ways that you can find individuals within your community that might be interested in getting involved in your coalition. Individuals through Special Olympics. You might have day program providers or disability service organizations. Sometimes there's supportive community living waiver programs that you might have in your area. it would be great to get them involved because they often have to have individuals within their programs integrated into the community. And so they're going to want to get involved in what you have going on in your coalition. Public health obviously is a great one to have on board. Your metropolitan planning organizations or your RPA, any type of transportation specialists, your Parks and Rec departments, city staff, any type of good decision makers. If you can get a council member involved in your coalition, that would also be great. Your policy decision makers, disability resource centers in your community would also be a great one to reach out to as well. Other ideas might be going through your schools, any types of local support groups that you have. The Iowa Department for the Blind might be able to help you get into touch with individuals with visual disabilities in your community. And so once you kind of have an idea of what organizations you want to involve in your coalition, it's really looking at then who within those entities might be interested in participating on your coalition. Identifying those individuals and then meeting with them to determine their level of interest and if it might be something that they would be interested in moving forward with. When you hold your first meeting, one idea might be to get a formal, this is a more formal process, but really a letter of commitment to help keep them engaged. There's a website called Coalitions Work that has a nice sample for a letter of commitment that you can use with coalition members. You will also want to identify, once you've got all of the individuals, you're going to want to identify a lead or community coach or a committee coalition chair, if you will. Often an entity that is going to be most neutral at the table might be a good one to get involved. Again, that might be your local public health agency. It might be working with your MPO or RPA, a type of transportation specialist. Would be good to identify as those leads of those coalitions. And then once you've kind of identified the organizations and you have the individuals that are interested in participating, then obviously we need to kind of get everybody headed in the right direction so that we can start implementing and making some of those PSE changes in your community. In order to do that, I think we really need to have kind of an understanding of who's at the table. Here on the slide are just some leading questions that you can ask. So, as a group, as a coalition, what are some of the things that you want to accomplish? Do we share common goals? What projects, programs do partners have coming up? Are there any new things that they're looking at doing? And what can we accomplish if we work together? It's just kind of bringing a common understanding of what their interests are, what the goals of the coalition members are, and really trying to identify some of those common goals. Some other things to ask is really identifying and trying to figure out what your coalition members' strengths are. So which coalition members and partners have a vested interest? Are there target audiences that each of your coalition members can help you reach? Maybe who has funds? Is there a nonprofit organization at the table that can help you support what it is that you're going to be doing and interested in implementing? Are there entities at the table or in the community that might be able to donate goods and services? Is there somebody at the table that can accept donations or manage the grants or help with grant writing? And identifying those members' strengths really will help you identify what their roles or potential roles could be. It'll also help you identify if you need to bring more individuals to your coalition. Once you have that done, it's really looking at developing a mission, right? So once we know what everybody's strengths are, we've got people around the table, we really need to come up with one common mission. This mission statement really should just kind of describe what it is that you want to do. It needs to be clear and concise and explain the outcome. So a sample might be working to build a healthy community designed to include people with disabilities by reducing barriers and increasing access to physical activity opportunities. And again, once you've got that done, it's starting kind of those formal meeting, that formal meeting structure in that process. And I think having well-led meetings is really vital to the success of your coalition. I've just found that keeping regularly scheduled meetings, we currently hold ours every other month, typically on the same day and the same time each of those months. Making sure that you identify roles for members, assign tasks for them, simple things like sending out agendas prior to the meeting and notes after your meeting kind of keeps everybody on the same page. I've also found that having a working agenda, similar to the layout shown on the bottom, just with the agenda items, notes, so it might be comments from what coalition members are saying, what your next steps are have been extremely important because it helps with follow through, and then assigning a particular individual to a task that needs to be done. All of these things have really worked well for us, keeps everybody on the same page, and it helps keep it moving us forward. One other little thing to think about is just making sure that your meetings are accessible. So are they being held in an accessible location? If you're in a larger metropolitan area, are they on a bus route? Are your meeting materials accessible? Meaning, do you send them out ahead of time? Do you use a larger point font, no italics, high contrast lettering with the backgrounds, just kind of like you see with a white background, black font, makes it easier for people with visual disabilities. You'll also want to assess kind of where your community is and collect some data so you know what changes are done. And there are several ways that you can do this. You might want to look at doing some surveys. You can do a CHI assessment, which in March, this is something else that I'll be going over, is this Community Health Inclusion Index assessment. So I'm not going to spend some time today on that, but we will be doing that in March. Conducting inclusive walk audits is a great way to kind of see the exterior of your community, access to facilities. Is it easy for people to navigate from one location to the other? And all the data that you collect can be added to your community health needs assessment. And this is, again, one way to ensure that you focus on this particular population, on people with disabilities, which will also help with your health equity. The next step, really, once you have that data collection, is developing an action plan. When you know what your needs are, then this is when you can start this process. Action plans, I think, really help, and they have helped us keep our coalition on track and really moving forward. So it's identifying our goals, how many people or what our estimated reach is going to be, identifying our objectives and how we're going to meet those objectives with our action steps, putting it on a timeline, who's going to be responsible for implementing those, what the benchmarks are so we know if we've met that, the evaluation process, and kind of where we are in that process and completing those goals. Here's kind of a look at a sample one that we've used. You can really use any layout that you want, but this has seemed to work really well with us. This is actually kind of the layout that we use with our NACDD grant. So it could be just a simple goal. You don't want to include too many, but you want to be able to make some progress toward making your community more inclusive. The estimated reach, just be clear on that. Identify the source that you're using for that information. You'll include the objective, again, being specific and measurable and realistic and timely. And then what are you going to do to, what are your action steps going to be? What are the steps you're going to take to actually help you reach that goal? And then here's just another sample goal of ours is to increase inclusive recreation programming at a minimum of 1 recreational facility by making a system level change. And this is going to be done by June 30th, 2022. So we're looking at just adding an inclusive division into some sports tournaments that are occurring here in Sioux City. And so we'll just be working with the different entities and the individuals that run some tournaments in our local area. And once you have your coalition kind of up and running and you've invested the time to make it a success, you want to make sure that that continues. You want to make sure that you're going to achieve your goals and those objectives that you've outlined. A lot of the things that I've already previously talked about will help contribute to the sustainability of your coalition. But some other things, I think these, we really have to make sure that we're investing in some of these to make sure that we are successful. I think effective communication, making sure that you're communicating with your coalition, you're having open, honest discussions with them will help you out in the long run. Efficiently run meetings, staying on task, keeping on your agenda, ending and starting on time helps keep people engaged. Again, making sure that you're following through on those action plans. I think it's important for coalition members to feel like they're actually achieving something. So sometimes having those quick wins is essential. For some coalitions, and this has been my experience, like it just takes too long for them. In public health, we tend to have a tendency to do things at a little slower speed. So I've just found some of those that are more in the public, not in the public, but more in a private business or a nonprofit organization, like to see things done more quickly. So making sure that you're just having some of those quick wins included. Really focusing on PSE changes, those policy, system, and environmental changes will help to make sure that we're sustaining and really making an impact in our community and taking photos and sharing those successes any way that you can through your coalition, through social media, on websites, helps to share your story. I also know that you're going to run into some roadblocks. We certainly have, and you've got to expect that. So the sooner that you can identify those challenges, the sooner you identify those roadblocks, problem solve them, address them, the better off that you're going to be. So yeah, some potential challenges you might have is keeping members engaged, keeping people with disabilities at the table, sustaining attendance, making sure that people are focused. So it's always redirecting and going back to that mission statement, or redirecting and going back to that action plan. We've had past grievances surface before as well between entities. So it's knowing how to navigate that. Might be bringing small groups of individuals together to discuss some of those things and really trying to keep people on the same page. You might have different entities with hidden agendas. They are only going to want to push one particular thing and not another. They might be more focused on physical activity or trails and less on nutrition if that's what you're doing, or whatever it might be. Communication, or actually lack of communication, the lack of results, which I've already kind of talked about, and then the speed of progress as well. So there's a really nice document here on the coalition's work website that I am, no, it's going to pull up, but I don't think you're going to be able to see it. So if you go to that link and you pull that, if you click on that link and you pull it up, it's really what to do when things go wrong. It's a document that kind of lays out what's happening, the problem, and some potential solutions. So it's a really nice handout that I think might be effective in certain instances for your coalition. So maybe bookmark that and keep that on hand. And then I've also included just some links to some local and national resources on the website. So Living Well Iowa, which is where this presentation, some of the other materials that we're going to be developing will be placed. The Iowa Department for the Blind, the Centers for Independent Living, Easter Seals, and then the Iowa Data Center is information on some of the stats for that I pulled up in the presentation earlier. The CDC Inclusive Healthy Communities model diagram that was included, there's a link to that. Coalition's work has a lot of great information. If you've not been to that website, I encourage you just to go there and kind of peruse through some of their materials. There's a lot of great information on that particular website. NACDD Healthy Communities Project, which is one of the projects that we participated in. There's a few nice videos. It might give you some concrete ideas of things that you can do within your communities to make them more inclusive as well. So I encourage you to check that website out and watch some of those videos. NCPAD is a great resource to have on hand. And then of course the CDC website. So our next webinar is going to focus on the CHI on-site assessments, which can be done in a variety of different settings in your community. This is that data collection component, which will really help kind of identify where you might want to invest some of your time and your funds and your focus to make your community, some of those buildings, those entities more inclusive and easily accessible. There's still time to register for this. So if you haven't had an opportunity to do so, which I think you did since you're all registered for this one, but if you know others that may want to participate in that, there'll be an opportunity for them to still register. There'll be more information on that. And now it is our time and trying to keep on task. It was a 30-minute presentation. We're allowing about 15 minutes for a question and answer session. So I am going to kind of open it up and see if anybody has any questions at this time.
Hey Angela, this is Alcano. Thank you so much for the great presentation. I'm really happy to hear there are some work in this area, because this is one of the things that you don't really see a lot. I mean, I've been in this area in Waterloo area, and then you don't even hear most of the time about this until recently that we start putting some of our work with, some of the coalition together. I'm from University of Iowa is working with us, helping in that, and there is a local organization, the YM, leading that, and I'm part of that. So it was just like when I saw that was there and I jumped into it, because this work is really overdue already, and not many things happening in this area. We talk a lot about equity. It is the forefront of everything that we do, and still this group of community are excluded in many ways, and we don't even think most of the time. We don't see there are a large group of people that are struggling with some sort of disability, because just we don't have really better database for that, better information for that, and you don't also see a lot of advocates for that. That's my view. So it's just kind of just like always bothers me in that area when I look at that. So no, thank you so much, and I'm really happy that there is initiatives, there are work that are impacting the lives of those people. So I'm grateful to be here and listen to you. So a couple of things that I've been talking. In our meeting, when we meet as a group, one of the things that you reminded me is we really did not think about including the MPOs and especially the transportation aspects into the work that we do. We try to do a little bit of survey, assessing agencies, just their understanding where they are, and then also families, how do they feel? So that's a good reminder, because I think for me that can be a good connection. I work with MPOs on physical activity for seniors, and just like a transportation route for city the group that are working for the city. So I think I can be, just you reminded me that I can connect the two that because I'm in a both group. So I can bring the both group together, that helps. But I do have a few questions for you. Probably before I go to my question, the first thing is, I really have this sense of we need to move beyond inclusion. When we're thinking of inclusion, this is my view. And then I also mentioned this to other group. When you are thinking of inclusion, what you're saying is our current system is working well. The only thing we need is we need to include people into that. But for me, it's this just simply trying to include people into the system that is not designed for their survival is inherently inequitable. So we need to really look into a system, what kind of system we have in place that is perpetuating the discrimination against this group of people. Focusing on the system, what inclusion is saying to me is, let's bring them in. Even if you bring them in, how many of, just like a building that I'm sitting in right now, there is no way for them to get in.
Yeah.
The system we have in place is not inclusive. I mean, it's not designed for them. It's not designed for them to try to survive. I think looking at the system is the first thing that for me is just like, as we want to include them, we have to also focus on really the system that is a barrier that is perpetuating that discrimination against people with disability. And then try to really move toward building sense of belonging. I can include you in my wedding party, but you don't belong in my family. You know, that sense of belongingness is what we need to work on focusing on a system, also sense of belonging. When you are working on a sense of belonging, in my view is you are bringing everyone, you help people to have that sense of belonging without taking their uniqueness away. I mean, in our meeting, one of the things that we discuss is we want to bring them into the other sport group. We want to bring them into other, just like with other groups that are doing. I really also think that they also need their own social capital where you bring them together, that group together, because they also need that. There is a social capital that they need when you bring people with disability together without the other group. That is also important part. So you really need to make sure that they belong in all of that group, in their own group, at the same time in the other group. And creating that sense of belongingness is really what I want to see. Go beyond inclusion and look at our system, and then really working on a system, and then also work to build that sense of belonging. We need to feel that they belong here with us. They also need to feel that they belong here with us. So that is really very important. But my question is, one of the things really we're really struggling with is, have you ever tried to address a group that are not really addressed? I mean, we don't really know. If you go to most of the minority group, most of the non-English speaking newcomers community, we don't even know the extent of disability in that community. And then one of my discussion with our group here, our coalition here in Blackett County, is how can we reach out to that group? There are several barriers that I see as myself from that community is disability, understanding of awareness of disability. They may not even see that is a disability that can be addressed. They may see that is just like something that is God-given, and then you have to just accept it, and then you don't really have to do anything about it. There is a social norm that work against that. And then there are so many barriers that I see in that group of community. And I don't know how large that group in your community, and then what can be done to address the group that is traditionally hiding. I mean, just like I can tell you an example. I've seen a family that hid their child for 7 years because the child had a disability. No one really knew that the child was in the house because it was traditionally it was embarrassment to the family if other people know, so they hid the child in the home for 7 years. That's a practical example that I've seen. So how do you address some of the cultural barrier, the belief in that group of community? If you have any experience that you can share with?
Yeah, that is a great point. Your comments are extremely enlightening, and yeah, I mean, even here, we've been doing this for quite a while, but we haven't kind of bridged that gap with people with disabilities who English is their second language, or who really maybe have that language barrier and don't speak English at all. Like we here haven't even kind of bridged that gap, to be honest. I think being able to reach out to those different populations and those groups and having focus groups, I think just starting with some education on disabilities and it's okay. Like people with disabilities need to be engaged in our community. And this is one of the these are the things that we're doing to be able to provide more equitable access. It might not be just a physical activity and nutrition, but across medical care and schools and everything else. We have systems in place, but sometimes those systems just don't work very well. And it's identifying why they're not working very well. What are those barriers? Working together as a community with your community partners to try to figure out a plan to move forward. It's not an easy task. It's not something that's certainly going to happen overnight either. I think something like that is going to be one of those more longer system level changes that are really going to require some in-depth analysis. It's going to require commitment and engagement across a variety of populations.
Yeah, no, absolutely. Thank you. I just feel that the struggle they are having is really not just bringing them to some sort of physical activity access, and it's beyond that. It's more of a system issue, a systemic issue that we really need to focus on that as we go forward. Yeah. And then, of course, just like we continue struggling with how to address some of the cultural norm and belief in that group of community, and they really struggle with that a lot. And anyways, thank you.
All right, well, thank you for your comments and your questions. Anybody else have any comments or questions?
I have a question.
Hi, Rachel.
Hi, I apologize. I missed the first introductory slide and then was just taken away a second. So I hope this is the right place to ask this question.
No problem.
I am just curious about whether the coalition that you're involved in there, Angela, was created, like, was it a board or council created commission, or it's just kind of an informal group? And how do you handle the policy recommendation part of it then, if that's the case?
Yeah, so our coalition is not a formal coalition. It's not a city or county board. We simply started out small. I just asked for involvement from different community partners, brought people around the table. We don't have like, I'm the chair of the committee. We have a kind of co-chair partner lead that was on our project, and that was our Metropolitan Planning Organization transportation specialist, one of the regional planners at Simcoe. We don't have a formal process, so it's really just our agendas. We send out notes. When we do any type of policy or environmental recommendations, I utilize the Community Health Inclusion Index, which the next presentation will be on. I use that tool a lot to do assessments in the community to not only gather data, but provide recommendations. And those recommendations really come from that assessment tool. And that would include any of those policy, system, or environmental changes. We ask at our coalition meetings for people to constantly keep inclusion in mind on any projects that they're working on, because there's always an opportunity to include maybe a disability component into a current project. And sometimes that inclusion focus really is not on the forefront of a person's mind when they're looking at doing other things. So I'll go back to one of the things that I did. I'm a health promotion specialist here. I was going out and doing assessments at like cafeterias on healthy nutrition opportunities. Until I started working with this project, I didn't realize, like, when I'm doing that, I should also be looking at accessibility. So how wide are the aisles? Can somebody from a seated position reach the beverages or items that are back on a far shelf? Or are they able to pour their own glass of water? Can they reach the utensils? So it was incorporating that assessment tool into something that I was already doing, which is a system level change. But I was almost doing them on two different spectrums when I could have been doing them together. And so, a lot of the recommendations that we make, policy system or environmental changes, are more of an informal process. So we do this TREE assessment, and then we'll write up a report, and those entities, if they want, they implement whatever they feel is feasible for them. So they're not like required to do it. The other thing is I do sit on, we have a active transportation advisory council here in Sioux City. That is a board that operates under the city council. So it's a board appointed, it's a board appointed position. So I sit on that. And so I'm kind of the entity that tries to look at accessibility and ADA compliance. And so a lot of what I do with this carries over into that. And so there are instances where I'm asking questions of city staff, and we're bringing it through that active transportation advisory council to be able to kind of increase more of the walkability, bikeability, accessibility components through that channel. So does that kind of answer your question?
Yeah, we're looking at trying to get something started here and just kind of try to weigh what you talked about, keeping people engaged, but kind of starting out.
Yeah, and
less.
ours is more informal, but it's worked really well for us. We haven't really had any issues with doing it that way. We do have a separate coalition, so we've got a large community wellness coalition, and I have this All Abilities Health and Wellness Coalition. So it's kind of a subcommittee of that. So we report out, we kind of give progress updates, but we are really kind of a working coalition underneath that larger community wellness coalition. That's kind of how we've got it structured here. So.
Thank you.
Yep.
No, I think that is, Rachel, what I've seen for us is, I think we are following what you have, Angela, and we have that community wellness. At the same time, we have this one, the Inclusive Health Coalition under that. I've seen, especially the community wellness one is around. I've been a member since 2014. It is working well. It's just like a volunteer-based kind of just like informal that work well than when you structure it in some sort of formal approach. I think that at least for us that been working very well, having that informal kind of gathering.
Well, Rachel, thank you for that question. Does anybody else have any more questions or further discussion? Because we are over our 45-minute time period. So if any of you would need to leave and we want to carry on the conversation, that's perfectly fine too. So just opening it up for additional comments or questions. Okay. Not hearing any. I guess I put up my contact information. I'd be happy to carry on this conversation further as you guys are working towards developing these coalitions. Feel free to contact me. We can kind of talk through some stuff if that would be helpful for you. I'm perfectly fine doing that. But we really have a real opportunity to make a difference and impact the health of all residents in our counties and across the state of Iowa. We really just have to try to make inclusion a forethought rather than an afterthought. So constantly having that inclusion mind, asking the right questions in anything that we're doing, so that we're not leaving out a segment of our population. So again, I just want to thank you for participating in today's webinar. We will be sending out a survey and evaluation on the webinar today. So if you just take a few minutes to complete that, we would greatly appreciate it.
Thank you.